A male patient is diagnosed with a stroke involving the Broca's area. Which of the following will most likely be present on physical examination? So this question is basically asking what kind of physical findings you will find when there's damage to the Broca's area. So just as a test-taking strategy, if you see a question like this beginning part here, the male patient diagnosed with a stroke, the stroke could be helpful to know that we're dealing with some sort of damage to the Broca's area, but this part really isn't necessary for answering the question. We just want to know Broca's area, and there's damage, so some sort of damage to the Broca's area. What will we see physically? So based on that, we have some choices here, and we have different types of physical findings. So for example, they have loss of smell, loss of taste, disorganized speech, hypersexuality. Which one of these is related to the Broca's area? So this is kind of like an identifying content kind of question. And as you can see from this picture, the Broca's area is identified here, and you usually see it in coordination with the Wernicke because they both have to do with different presentations for a similar kind of condition. So you may have heard of Broca's aphasia or Wernicke's aphasia. So aphasia refers to difficulty with speech, and it is often seen as a side symptom of a stroke. And the difference between the Broca versus the Wernicke are kind of like opposites of the same thing. So Broca has to do with the expressive speech, and the Wernicke has to do with the receptive speech. The difference meaning that expressive is like expressing it themselves, like talking. So actually putting their thoughts into words is difficult. So producing the words would be difficult in expressive aphasia. As opposed to receptive aphasia, it's difficulty receiving the speech or understanding it. So they may read or hear some speech, and then when they have to interpret in their head what they're hearing, what they're listening, that would be challenging. So receptive, so difficulty interpreting speech. So all of that relates to the Broca's area. And as we can see in option C, disorganized speech is an option because Broca's area aphasia would have difficulty organizing or expressing that speech. So option C would be correct. It would not cause loss of smell or loss of taste or hypersexuality. Some things that may relate to these other options, as we can see, loss of smell. Maybe there's some sort of issue with cranial nerve number 1, because we know that this is your olfactory nerve, which is related to smell. Some people remember that olfactory. Think of a factory where they're baking some sort of sweets and it smells very nice. That could help you to remember that meaning. So now what we're looking for here. Loss of taste could be related to other cranial nerves, such as cranial nerve 7 and 9, the facial nerve and the glossopharyngeal nerve, so not related to the Broca's area, so we can eliminate that. And then hypersexuality could be linked to a bunch of different reasons. It could be side effects of certain medications, some different sorts of psychiatric mental health conditions could potentially lead to that, but not the Broca's area. This is what we're focusing on in terms of speech, so we can eliminate option D as well. So option C, disorganized speech, would be the answer of what we'll see in physical exam with damage to the Broca's area.